ஆண்களுக்கு குறிப்பா ஒரு 50 வயசு தாண்டியோட ஒரு பிரச்சனை அதிகமா சொல்றாங்க. பெண்களுக்கு ஒரு பிரச்சனைகள் பார்த்தா ஆண்களுக்கு அப்படி பார்த்தீங்கன்னா prostate அப்படின்னு சொல்லக்கூடிய பிரச்சனைகள் அதிகமாக ஏற்படுகிறது. இது ஏன் ஏற்படுது? இதனால என்னென்ன பாதிப்புகள் இருக்கும்? நிறைய பேருக்கு விஷயம் தெரியல. இதனால தான் இந்த பிரச்சனை இருக்குமா தெரியாது. காலம் கடந்து மருத்துவரை சந்திக்கிறார்கள். சரி, இந்த prostate பிரச்சனை வந்ததுன்னா அதை எப்படி நம்ம எதிர்கொள்ளணும் எப்படின்னு யோசிச்சு பார்க்கும் பொழுது அதற்கு உரிய ஒரு சிறப்பு மருத்துவரால் தான் அதை ரொம்ப தெளிவா ஈஸியா நம்மளாம் புரிஞ்சுக்கிற அளவுக்கு சொல்ல முடியும். இந்த துறையில் வல்லுநரான டாக்டர் பி சிவராமன் அவர்கள் I now invite to give a detailed information.
So I am biased with men actually. So I have taken only the urological problems in men in this talk. And actually urology is a subject which involves these organs, the kidney, the ureter and the bladder. Do you have a point? So this is the kidney, this is the ureter, this is the bladder. So if you see in another angle, the kidneys are at the back, near the spine. And see, the bladder is inside the pelvis. They are all well protected. That's why injuries to kidneys are very uncommon. I am not talking about any disease of the kidney or the ureter or the bladder. Actually, kidney separates urine from the blood. There is some common misconceptions that when we say that stone diseases are there, we tell them not to eat a lot of tomatoes or brinjals. They think the seeds in that brinjal and tomato come and form the stone. Actually, whatever you take through your stomach will never come to the kidney as such. It has to be digested, metabolized, and then absorbed in the bloodstream. Then only the blood will come into the kidney. கிட்னிக்கு நேராக வராது எப்போதுமே. ஜீரணான உணவுலேருந்து பிளட்லேருந்து தான் கிட்னிக்கு சப்ளை வருது. அதுலேருந்து தான் கிட்னிலேருந்து யூரின் வெளியே வருது. அதனால் நீங்கள் சாப்பிட்ற சில பேர் சொல்லுவாங்க, ஒய்ஃபை வந்து சரியாகவே நீ அரிசியை க்ளீன் பண்ணல, கல்லெல்லாம் போட்டு எனக்கு கல் வந்துச்சு அப்படின்வாங்க. அந்த மாதிரிலாம் கல்லுலாம் இட் வில் நாட் கோ இன் டு த கிட்னி, நெவர் இட் வில் கோ. ஸோ ஐ டோன்ட் திங்க் தட் இட் இஸ் டியூ டு த wife. It is you are forming stone because of your diet and other considerations. So the kidney disease அது ரொம்ப முக்கியமான விஷயம். Actually urology itself is a very secret subject மாதிரி. எல்லாரும் especially elite people will say that he is my cardiologist அப்படின்னுவாங்க ரொம்ப பெருமையா. அந்த மாதிரி யாரும் urologist சொல்ல மாட்டாங்க. They don't even want to know they have a urological problem. Though it is very common, it is not flaunted with. So another the picture, how it is in the back side. Bladder is here. Why I want to show these films are because you should know what is urology and where is it situated. That's why I am showing. This is the bladder where it is stored, urine is stored, and urine gets stored. Two ureteral openings are there. These come and open from the kidney. It is very sensitive to expansion. Once it started to expand to a certain degree, it will send signals to the brain that it wants to empty. Then brain will signal the relaxation of the sphincters and contraction of this muscle, and you will pass urine. This is very good because if you don't have this, you will be like a child passing urine as soon as it becomes full. So you have a control. Upper centers control the urination. And here is the prostate. Prostate is fortunately only in the men. It forms around the urethra. This is the thing which gives trouble after 50 years. So another picture which shows bladder, urethra, surrounding which is the prostate, And this is the urethra through which the urine comes out. Another view. Urinary tract, as I told you, kidney function is filtering and formation of urine. How it is sent, I told you, how the bladder contracts and then the urine comes out. So, when the prostate enlarges, see, it's only a picture's demonstration. When the prostate is normal, urine is flows very well. He is very happy. And then if it enlarges, it reduces a bit, then he is not happy. He is very sad when completely it gets obstructed. That means when the prostate enlarges, it blocks the urinary passage as it is surrounding the urinary passage. There is a condition called prostatic enlargement. So this is the prostate. See, the prostate is totally inside. Nobody can feel it from outside except when they do the rectal examination. We have to put a finger in the rectum and then find out how big it is, whether it is cancerous or ordinary prostatic enlargement. But this picture shows how it will look like when you put the endoscopy through the urinary passage. This is the prostatic lobes, which both obstruct the urinary passage. This is the urinary passage. So, if it enlarges too much, it will completely block it. This is the ultrasound which usually we do to see the prostate. See, the prostate is enlarging into the bladder. So, the symptoms of prostate, of ordinary non-cancerous prostate as well as prostate cancer is frequent urination, especially in the night. 4 or 5 times they will get up in the night. And then flow will be interrupted and difficulty in passing urine. They have to strain to pass urine. And then burning micturition, sometimes blood in the urine, pain in the back and the hips, pain during ejaculation. All these things are symptoms of prostate problem. And what happens if you don't treat the prostate? All men, due to aging, they will develop prostatic hypertrophy. Some may turn into cancerous, most of them are not cancerous. But what happens is, when you have prostatic enlargement, one of these days you will have sudden stoppage of urinary passage. Completely it will stop, then you have to go to the emergency and put a tube and remove it. And then if it's long standing, if the prostate is there, it will become thickened bladder like this. This is the bladder we see through the endoscopy. And then urinary tract infection will come, and then blood will come. Sometimes stones, bladder stones. This is a stone which is inside the bladder. We see the light. We should put a cystoscope inside and see the bladder. Then you will see all these things. So for a long time, if the prostatic hypertrophy is not treated, then the bladder becomes weak because it is straining all the time to pass urine, and it is not able to pass urine completely. So the strain becomes too much, then it becomes very weak one day. That's why it is called decompensation. Then he will go in for retention of urine. That means he cannot pass anymore. So how does it affect the quality of life? It can cause sleep disturbances and then disruption of social life. See, actually, when we go to a function or something, you'll always see where is the toilet, because you know that you'll have an urgent urination and you will not concentrate on people or other things in the function. Finally, you feel where the toilet is because you are worried urgently the urine will come. Then you get to go urgently to it. If not, you will just drop out of the thing. So, psychological burden will be there. So whenever you are invited to a function, you will say why I should come, whether it is necessary or not. Like that, people will be isolated. These are all the, and then once prostate is very large, sex life will be affected. So most of the people do not tell that there is a problem because of fear of surgery. And if they are worried, the doctor will say they got a cancer. So these two things only make them not to come to the doctor. Actually, if you come early, 80% of the prostate enlargement are not cancerous. You need to give medicine and cure them. So how do you diagnose evaluation? You go by the symptoms, whether it is interrupted stream or not able to pass urine properly, and then the digital rectal examination. See, this is very important part because we have to put a finger in the rectum and find out where the prostate is, and then whether it is cancerous or not, and then urine lysis, and then uroflow studies, how speed the urine comes. This is only a joke regarding how a person is afraid of rectal examination. This is how we do the examination. You put the finger inside and see the prostate. See, prostate is from the urethra of the bladder, and we can easily feel it through the rectum. This is very important step to diagnose cancer. So this is uroflowmetry, how the speed of urine is. So how do you treat this? There are some options. If it is a very early stage, we can manage it by simple observation and lifestyle modification. Suppose there is lot of symptoms like patient is bothered by it and the quality of life is being affected, then we can give minimally invasive therapies and medications. Medications are, normally the prostate is enlarged and there are some smooth muscles and also the bulk. So we give medicines to reduce the bulk of the prostate as well as relax the muscles in the prostate so that the urinary passage will be very clean and he will pass urine fully. There are a lot of medications and most of the patients are only treated with medicines now. Only when medication fails, we will suggest them operation. Operation itself is not done open surgery nowadays. It is done through the transurethral resection of prostate. Urinary passage itself, we pass a tube and with electric current, we cut the prostate. Then it becomes a hollow tube. Then urine will pass very well. So 30 to 40% patients sometimes cannot follow medical therapy because some people are not very happy about the outcomes and the side effects are there, like slight giddiness will be there from people and they will have retrograde ejaculation. Suppose when they have sex, they will not be able to ejaculate completely because of the relaxation of the bladder sphincters. So some people just leave it and they don't want to do the medical treatment. So if the prostate is very big, then we'll have to open and do through the bladder. The entire prostate is being removed. Nowadays it is done very rarely because people come early. So transurethral resection of the prostate is the gold standard for doing a prostatic resection. This is the view when you see from the bladder. You see? You put a tube inside, you go into this will be bladder, this is prostate. Can you put the slide? So when you put the tube inside, this is how we see. See, we just put in the tube, you can see with the camera. See, this is the broad prostate. These two lobes are obstructing. Then what we do, we enter the bladder, this is the bladder. See, we can see the bits which have been cut. This is inside the bladder. So we resect it with the electric loop inside itself. It is like grating a தேங்காய் திருவுற மாதிரி அது பண்றோம். அதில் வந்து whatever bleeding is there, we then and there coagulate it with our electric current. So this will not, it's only bipolar current, it will not affect the body. We have a current going out through another method, so nothing will happen to the body. This has been the gold standard for prostate operation. All prostates are done like this only nowadays. Sometimes we can use a laser also for resection. This is how it will be when you see inside the bladder through your endoscope. So we don't cut open and do that. See, this is the other lobe, how it is seen. That is the cut bit. That is the cut bit. That bits will go inside. Then what we do is, we give a wash and remove it through the tube itself. So all the bits will be taken. Then we will put a catheter for the prostate to heal. Next slide. Okay. Once you operate, this will be the big gap there, because it was obstructing before. All that obstruction has been taken, then it will be like that, so that the urine will come very clearly. Sometimes there will be some incontinence for some time. Patient may not be able to control it, and it will slowly get better after some exercises. Not all people will get incontinence, and then the impotence is there to 4 to 30% of people, but retrograde ejaculation will be there. Usually it affects the people after 65. Nowadays, above 65 people don't even have a room with their wife. So sexual life is not be a great problem. I think the daughter-in-law will send her in the hall. So apart from the operation, apart from the medical therapy, there are phytotherapies. There are, see, in Australian aborigines, what they did was, they used to go into the forest in the night and stay there for a few days and then come back. Then everybody thought why they should have this all the time. Then they followed the people and found out that they go and take one bark of a tree, dwarf palm tree, and then they put it in the water and boil it, and then take the water. Then they are able to pass urine well. So they found that, so the British scientists followed them and found that Vigenium africanum, there is a dwarf palm tree whose barks are having Vigenium africanum extract and saw palmito. There are barks they found, and it is very popular in Europe now. Actually, Europe, about 60% of European doctors prescribe this type of thing. We also do it, and we have this. It is part of the medical therapy. I this much for the non-cancerous. Prostate cancer is same symptom, same thing. Only by our digital examination we can find out. And another blood test is there called PSA, which is prostate specific antigen, which will be raised in cancer prostate. We do two things. We can find out whether the person has got a cancer or only a benign prostate hypertrophy. And once we suspect that, we have to take a biopsy and then prove it. Once you prove it, it is proved as a cancer prostate. It is in India, it is the highest cancer in a male incidence. Highest cancer in a male. Previously, it was lungs. Now it has become prostate cancer. And it is in the middle of all the cancers. So cancer prostate, predominantly now in India, we don't detect it early. Once it comes as a metastatic, it spreads to all the bones and other parts, only we diagnose, because people don't come early because they don't have any symptoms. So this is how, as doctor said, you should do master checkup, PSA, and digital examination by a urologist. If you do that, then you can detect it early. Once it is detected early, it is totally 100% curable disease. It is one of the cancers which is totally curable if it is detected early. That is the thing we insist on, so that people should come forward above 50. Especially if the cancer is there in one of the family members, the other family members should start checking early. Instead of 50, 40 years itself they have to do the PSA. So this way they will detect it early and it can be completely cured. So this is called advanced prostate cancer. This is the spine. Can you see, this is the spine. Entire black things are all cancer spread all over the spine. This is late stage of cancer prostate. In this stage we cannot do much about it. So detection by PSA and digital examination. Treatment by radical prostatectomy. Nowadays robotic surgery has come and radiation is another process. So lack of awareness only creates all this problem. Robotic surgery has become in a big way. It is available in Madras now, and people can just get this operated and walk home on the second day. First day itself they can get up and go to the toilet. So such is modern robotic surgery's effects on CA prostate. So this is the robotic surgery, robo. What is robo is, this is the whole instrument. So it will be like this. The robo will be near the patient. This is the console where the doctor sits. He will not touch the patient. Only the robotic arms will touch the patient. And it is so precise, it is 10 times more magnification than normal eye can see. So all structures will be very clearly seen. So it can easily perform it, and the blood loss is very minimal. So this is the best way of doing cancer prostate nowadays. So this is another view. This is how you see in the magnified area the prostatic cancer. This is how the small instruments you can see. With such a wide variety of options available to us, how do we select which one to do? So it has to select which dog it should fall prey. So we have started an Indian Prostate Cancer Foundation, which is primarily to prevent needless suffering due to prostate cancer, awareness, health education and training. To prevent needless suffering due to prostate cancer, a conglomeration of medical fraternity, prostate cancer survivors, families and people from different walks of life. We do free camps. This we have connected with Mr. Subbaraj to conduct a free camp for the Senior Citizens Forum also. We have done free camps for the army, protecting men who protect us, and small but sure steps towards preventing needless suffering. Join the initiative, just talk about the prostate cancer. Only a small saying, somebody once asked God, what surprises you most about mankind? God replied, they lose their health to make money and then lose their money to restore their health. By thinking anxiously about the future, they forget the present, such that they live neither for the present nor for the future. They live as if they will never die, and they die as if they never lived. Live today happily, enjoy today's pleasures. I mean, this is not the way the pleasures they enjoy, but thank you very much.
Cardiac care பத்தி பல விஷயம் சொன்னாலும் எப்பொழுதுமே நம்ம அடுத்து என்ன நமக்கு தகவல் கிடைக்கும் அப்படின்னு எதிர்பார்க்கிறது தான் மனிதன் இயல்பு. அந்த கார்டியக் கேர் சம்பந்தப்பட்டு நம்ம சொல்வதற்கு டாக்டர் வி உமாபதி அவர்களை அழைக்கிறோம்.
These things have been given as a printout to all of you. Heart is a hollow muscular organ situated in the center and to the left of the chest between the two lungs. And it consists of 4 chambers, 2 on the right side, 2 on the left side, which work in a coordinated manner so that the right sided chambers take the blood to the lungs for purification, which is to acquire oxygen from the lungs, and then return to the left side of the chambers, which supplies blood to the entire body, including the heart. The heart, as an organ, consists of 3 layers when you cut it across like this. The innermost layer is called endocardium, the middle layer is called myocardium, and the outermost layer is called epicardium. And the whole heart, both right side and left side chambers, are covered in a sac called pericardium. The right atrium receives blood, so-called deoxygenated or impure blood from the entire body, sends it to the right ventricle, from where the blood flows to the lungs, gets the oxygen, comes to the left atrium, from where it is mounted to the left ventricle, which is the most important chamber of the heart. The left ventricle supplies blood to the entire body. The so-called impure blood reaches the right side, goes to the lungs, and the oxygenated or pure blood comes to the left side, is supplied to the entire parts of the body through a tube called aorta. The organ which is supplying blood, receiving the impure blood, supplying to the lungs, receiving the pure blood, supplying to the entire body, itself acts like a motor which requires petrol. That blood supply to the heart is supplied by two main arteries, right and left. Normally they divide into three branches. The speciality of these branches, these arteries, is each artery supplies a definite or defined portion of heart muscle. The heart can be affected by many diseases. Some of them are from birth, called congenital heart disease. Couple of diseases are acquired by infection. Commonest example in our country is rheumatic fever, which affects a major part of the population in the rural areas. And some diseases are affected by inflammation of the heart muscle. But the bread and butter of the present generation cardiologist is coronary artery disease, which is disease of the blood vessels supplying the heart. Apart from the blood vessel disease, the heart muscle, the middle layer of the heart called myocardium, can be affected directly by various diseases. That's called cardiomyopathy. And there are diseases that affect the covering of the heart called pericardial disease. Okay, now we are going to concentrate mainly on the coronary artery disease, which forms the bulk of the practice of a cardiologist. What are the common symptoms? You can have anything in the list, starting from chest pain, breathlessness, cough, syncope, palpitation, easily getting tired. But there's one thing which can never make you understand that you have a heart problem. It's called silent ischemia, where you don't feel anything. This commonly happens in people who are chronically diabetics, where there is affected nerves which do not allow you to feel the sensation of pain. You never feel the pain. You go for some checkup, you'll go for a regular diabetic checkup where they do like a master checkup, a part of it as an ECG. They'll tell you go see a cardiologist. And you ask why, you have already suffered a heart attack, which you never felt. Silent heart attacks are very common in diabetic people. So just because you don't have a symptom, don't feel you are immune to disease or you are free from disease. Coronary artery disease is caused by a pathological process called atherosclerosis, which is nothing but deposition of fibro, which is like a fiber, fatty substance in the lumen of the heart, also the wall of the heart, in the artery. This, as Professor said, starts, I will put it early. It starts from the age of 2 years, not in the decades. But the issue is how rapidly progresses, or what is the rate of progression from a simple streak to an unstable plaque is determined by nobody else except you. I'll come to the list. So once a simple plaque becomes the right extreme where there is sudden rupture, till then the blood supply would have been flowing. When that ruptures, when that plaque ruptures, as Sar said, a person with 99% occlusion is living for years later on with modification of his lifestyle. So even a 99% occluded artery, there will be flow. But When it ruptures suddenly, it makes it 100% and then leads to a heart attack, which is called myocardial infarction, where there is death of the middle layer of the heart. Unfortunately, this death is not reversible if we delay in time. We call it as golden rule, golden time rule, where if you reach a hospital within 90 minutes, either by giving certain medications or by doing an angioplasty, where you re-establish the flow of blood, we salvage the heart muscle, which is worth more than millions. Unfortunately, how many of us turn to the hospital in this traffic? The delay in time results in permanent death of the heart muscle. Now, we spoke about heart attack. Who is more vulnerable? So, by consensus, we have developed a chart of risk factors by which none of us are immune if we belong to these four categories, where these risk factors cannot be modified. If you are a male, ladies till the menopause are sort of protected, but even that saying is becoming false now. However, majority of ladies till their menopause have lesser heart attack rates than compared to their male counterparts. So being a male, elderly people, if you have a strong family history of death at younger age group, or if you are a type A personality, very aggressive, these four categories are called non-modifiable risk factors. This is the list where we are responsible. Smoking, diabetes, sedentary lifestyle, high blood pressure, obesity, high cholesterol, and please, though it is listed at the end, that is the first culprit for majority of problems in the present age. Stress, about which SARS spoke at length. How do we diagnose? When you go with an acute situation, acute condition, there are certain biomarkers by which we assess not only the timing, also the extent of damage to the heart muscle. They are called biomarkers. Otherwise, routine checkup, we make sure that you are not anemic, because anemia can mimic heart problem. Lower the hemoglobin, higher the incidence of symptoms of heart problem, but you will not have a heart problem. How are the blood sugars? How are the cholesterol levels? All these things normally form the basis of biochemistry investigations. And then the simplest tool to assess as a horoscope is an ECG. ECG tells us almost 90% of problems when taken during a symptom, during a complaint. Otherwise, as a resting ECG in an asymptomatic person, a person who doesn't have a complaint, we may not pick up an acute problem. The other investigations are to help us guide the way we have to proceed in the management schedule. Echo tells us about, if at all somebody had a heart attack, what has been the damage to the heart muscle? How viable is the heart muscle? How much is the effect of the damage to the heart muscle resulting in defective pump function? How is the lung pressure? How are the valves? All these, is there any fluid around the heart in the pericardium? All these things can be assessed by an echocardiogram. A person who has got a normal ECG without pain, no pain, ECG is normal, but whenever he exercises, he complains of discomfort, making him to stop, which is called a stable angina status, can be confirmed on an exercise ECG, where we reproduce a situation. Make him walk, make him exert, make him get the pain, see how the ECG is. If it is related to the heart, you're going to have supportive evidence. All these things guide us to the final gold standard test, which is called an angiogram, which can be done in two ways. As an outpatient procedure, we call it as CT coronary angiography, which is like a still photograph. Otherwise, it's like a video called conventional coronary angiography, which tells us the exact situation based on which we decide the management. The treatment, if somebody cannot afford an angiogram, or somebody is not interested in angiogram, or you have done an angiogram where the disease is only mild, minimal, or too extensive. If you have disease in all three arteries supplying the heart muscle, then we go with the first option, which is medications. Medications, multiple medications are there. These are for stable people. Somebody coming with a heart attack, within that stipulated period, we stretch it to 4 hours. Then we give a medicine, which is a clot burster called thrombolysis, by which earlier intervention, if you can do it as early as possible, we can achieve up to 90% of thrombus dissolving. After this, we decide based on the anatomy of the blocks, number of blocks, either an angioplasty or a bypass, whatever may be suitable for that particular individuals, not only in the shorter acute term result, but also for a better long term result. Now, how do you prevent? You diagnose when you have a problem, you advise whenever you see a problem, you treat whenever you see a problem. But how do you tell people that don't get into a problem? That's called primary prevention, which basically applies to everybody, particularly for people who are at higher risk, people who have stronger family history, people who are above 40, people who have stressful life, people who are sedentary, smokers. These people should be aware that they are prone for problems. Should go for appropriate screening as advised by the medical people. Follow a good, healthy diet and exercise regularly. Primary medications, now you all will be aware. Cholesterol medications, aspirin, an aspirin a day keeps a cardiologist away. All these things are primary preventive drugs, which have to be taken as required by the particular individual. And again, though listed in the last, try to have a stress-free life. After you have had a problem, you have had a heart attack, we have been advised to continue medications, you have been asked to undergo angioplasty or a bypass, that's not the end of the treatment. In fact, that is the beginning of the treatment. Somebody had a heart attack, somebody had an angioplasty or a bypass, cannot be without these restrictions. These are to prevent a problem in the future. So, lifestyle modification is the most important one, which includes diet and exercise plus relaxation. The relaxation applies only to the mental aspect, not to the physical aspect. So you have to exercise regularly, control the risk factors, and follow up periodically. Now remember, nothing is impossible, sir. Nothing is absolutely impossible when you approach it methodically. Now, let us accept, my father has diabetes, I am proud to develop it. I have a 25-50% chance. Let me accept it. So let me go for a checkup periodically. Now this doesn't apply only genetically. Physically we abuse our systems in all the ways. Not only you, environmentally everybody else are abusing your system. So let us accept that we are all predisposed to have a problem and act accordingly. Stress kills us. This is not a myth, it's a truth. Let us kill it. Thank you.